This is a 45-minute body scan for mindfulness-based stress reduction. The body scan is an exercise designed to help focus your attention on your body and become aware of bodily feelings. Learning to become aware of sensations in the body can help us recognize when we've done too much and need rest, when we're hungry and need to eat, or when we're getting stressed and anxious and need to find a beneficial way to respond. So in this way, this is a practice that helps us with our own self-care. During the body scan, we will focus attention on different parts of the body. Focusing attention on different parts of the body for some period of time can help us feel more in contact with our own body. During the body scan, we will be switching our focus to different parts of the body, sometimes focusing on just one small part of the body, and sometimes focusing on several parts of the body all at the same time. During this experience, you will be asked to notice what sensations you feel in the body, including noticing when you don't feel anything at all. So there's no right way to feel during the body scan. Whatever sensations you do feel, or whenever you don't feel anything, whatever your experience is just fine. It's just the experience that you're having right now. So as best as possible, let go of the tendency to want the experience to be different than the way it is. Just allow yourself to be exactly as you are right now. So during this practice, your thoughts will wander regularly, and you may get distracted now and then. This is not unusual and happens to everyone. All you have to do is just notice that your attention is no longer on the part of the body that is the focus of the body scan, and return the attention, refocus the attention back to the part of the body that's the focus of that part of the body scan. So there's no need to give yourself a hard time whenever you get distracted. Remember that the practice is learning to notice when the attention has wandered and is no longer focused on the body. It's important to understand and accept that each time you practice a body scan, it may be different. Everyone has their own experience and their own pace of learning. It's also important during the body scan not to try to relax. Trying to force ourselves to relax often just creates more stress and more tension. So the purpose of this practice is to help us develop the ability to focus our attention, become more aware of bodily feelings, and to allow our experience to be just as it is without trying to change it. If you are able, begin the practice by perhaps lying down in a comfortable position on your back if that's comfortable for you. It's perfectly fine to place something behind the knees to support your back if that's helpful. If at any time during this body scan practice you become physically uncomfortable or in pain, just gently adjust your body so that you are comfortable. This practice is about the sincerity and the quality of attention, not the specific position of the body. So perhaps begin by bringing attention to what it feels like to just be lying here right now. Perhaps aware of the room, maybe aware of temperature, perhaps noticing whether what you're lying on feels hard or soft. And if you care to, perhaps focusing the attention now on the sensations of breathing, not changing or manipulating the breath in any way, just noticing the sensations of feeling the breath in the body. Perhaps noticing the rise and the fall of the belly as the belly inflates with the in-breath and deflates with the out-breath. And just letting go of any ideas or expectations about this experience. And just focusing the attention on the sensations of feeling the full duration of the in-breath and the full duration of the out-breath. Anytime during this practice that you notice that the attention has wandered and that you've become distracted, no big deal. Just notice that the attention has wandered, that distraction has occurred, and then without giving yourself a hard time, just gently refocus the attention back to the breath or back to whatever part of the body is part of that part of the body scan. So perhaps beginning by now focusing the attention on the left big toe and just noticing whatever sensations are present right now to be felt in the left big toe. Perhaps noticing if there's some sense of tingling or throbbing or pulsing, maybe warmth or coolness, maybe the sense of touch of clothing or a blanket, or perhaps no sensation at all. And just noticing what the experience is right now of focusing the attention on the left big toe. And if you care to, focusing the attention now on all of the toes of the left foot. Perhaps focusing the attention on each individual toe, and just noticing whatever sensations are present right now in the toes of the left foot. Again, perhaps noticing tingling or throbbing, coolness or warmth, dampness, or no sensation at all. But just allowing the experience of focusing on the toes of the left foot to be just however it is right now. Perhaps focusing the attention now on the bottom of the left foot. On the ball of the foot, the arch of the left foot, the heel of the left foot. Perhaps noticing the sensations of contact or pressure as the heel touches whatever it is you're lying upon. And focusing the attention on the sides of the left foot, the top of the left foot, the area of the ankle, of the left ankle. And including in this focus of attention the entirety of the left foot and the ankle. And just again, noticing whatever sensations are present, whatever this experience is, of bringing attention to the left foot and the left ankle. And focusing the attention now into the left lower leg. Bringing attention to the shin or the front of the left lower leg, the sides of the left lower leg, the calf or the back of the left lower leg. Perhaps again noticing sensations of the touch of clothing, the sensations of air on the skin, or the sensations of pressure as the calf is in contact with whatever you're lying on. Or noticing no particular feeling at all, but just allowing that experience to be however it is right in this moment. And focusing the attention now to the area of the knee of the left leg. The back of the left knee, the sides of the knee, the area of the kneecap. Just again noticing whatever this experience is, of focusing the attention on the area of the left knee. And allowing now the focus of attention, if you care to be in the area of the left thigh. Bringing attention to the front of the thigh, the sides of the thigh, the back of the thigh. And again, just noticing any particular sensations, any sense of touch or contact, any sense of tension or tightness or softness, coolness or warmth, or no sensation at all. And letting go now of focusing the attention on the left thigh. And if you care to, now focusing the attention on the big toe of the right foot. Focusing attention in the same way on the big toe of the right foot. And again, just noticing whatever sensations are present right now to be experienced in the right big toe. Tingling, throbbing, temperature, touch, or no sensation at all. And including in this focus of attention all of the toes of the right foot. Just allowing the experience of bringing attention to the toes of the right foot to be however it is. And focusing the attention on the bottom of the right foot, the ball of the feet, the arch, the area of the right heel, perhaps again noticing any particular sense of pressure or touch as the heel is in contact with whatever you're lying on. And allowing the focus of attention to include the sides of the right foot, the top of the right foot, the area of the right ankle. And bringing attention to the right ankle and the whole right foot. And just feeling whatever sensations are present in the right ankle and the right foot. However it is right now. No need to change this experience, no need for it to be any different than it is. Just noticing what sensations are present, if any, in the right foot. And focusing the attention now into the right lower leg, in the area of the shin or the front of the leg, the sides of the right lower leg, the back of the right lower leg. And again, just allowing whatever sensations are present to be felt however they are right now. And continuing to focus the attention now into the area of the right knee, the back of the knee, the sides of the knee, the area of the kneecap. And focusing the attention now on the thigh of the right leg, including in this focus of attention the front of the right thigh, the sides of the thigh, the back of the thigh, perhaps again noticing areas of touch or contact, the feeling of air across the skin, sensations of tightness or softness. expanding this focus of attention now to include the entirety of both legs. Including in the focus of attention the feet, the lower legs, the knees, the thighs of both legs. And if you care to, perhaps allowing the legs to feel a bit softer, to relax a bit, to maybe feel a bit heavier. As they rest in contact with whatever you're lying on. Or just noticing that there's no particular sensations at all, but just allowing the experience of bringing attention to both legs to be however it is right now. And letting go now of focusing the attention on the lower legs, and focusing the attention into the area of the pelvic region, the left hip, the right hip, the area of the buttocks. And again, perhaps noticing any sense of pressure or heaviness or contact as the buttocks rest on whatever you're lying on. Noticing any other particular sensations that are present in the area of the pelvic region and the hips. And allowing that experience to be however it is, right in this moment, without needing to change it in any way. And focusing the attention, if you care to, now in the area of the lower back. Just experiencing the lower back however it is. And perhaps noticing if any kind of thinking has occurred around the experience of bringing attention to the lower back. Any kinds of judgments or thoughts of unpleasantness about the lower back, and just notice if that's occurred. And again, without giving yourself a hard time, just refocusing the attention again back to just the sensation that's present in the lower back. Perhaps including now in the focus of attention the area of the middle back and the upper back. And including in this focus of attention the experience of the entire back. Perhaps resting, Perhaps noticing the pressure or contact with whatever you're lying upon. And focusing the attention now on the area of the belly and the abdomen. Perhaps including, again, an awareness of the sensations of the breath, noticing the sensations of the rise and fall of the belly, on the inhale of the breath and the exhale of the breath. And just focusing the attention on each breath, the full duration of the in-breath and the full duration of the out-breath. Perhaps including in the focus of attention the area of the chest, and bringing awareness, focusing the attention now to the entire trunk of the body, the belly, the chest, the lower, middle, and upper back. And again, if you care to, just allowing this part of the body to feel a bit softer, to relax a little bit, and perhaps feel a bit heavier as it rests in contact with whatever you're lying on. And just noticing the consequences of having softened in this way. And focusing the attention now, if you care to, on the fingertips of the left hand. Just noticing whatever sensations are present in the fingertips of the left hand. And again, perhaps just gently noting, is there tingling or throbbing or pulsing? Some sense of touch or contact? A feeling of warmth or coolness? And including in the focus of attention all of the fingers of the left hand. The thumb, the forefingers, perhaps including in this focus of attention the palm of the hand, the back of the hand. And again, just noticing whatever sensations are present in the experience of the left hand right now, in just this moment. And focusing the attention now on the area of the left wrist, the inside and the outside of the left wrist, and the left lower arm. The inside and the outside of the forearm. Again, just noticing whatever sensations are present just as they are. Just allowing this experience to be however it is right now. Including in this focus of attention the left elbow, the inside, the outside of the left elbow, continuing to focus the attention now into the upper arm of the left arm. The biceps, the front of the left arm, the back of the left arm. And letting go now of focusing the attention on the left arm, and now bringing attention or focusing the attention on the fingertips of the right hand. And in the same way, just noticing whatever sensations are present in the fingertips of the right hand. Tingling or throbbing, some sense of touch or temperature, or no sensation at all, but just allowing that experience of focusing the attention on the fingertips of the right hand to be just as it is right in this moment. And including in the focus of attention now the fingers and thumb of the right hand, the palm of the right hand, the back of the right hand. And again, just noticing whatever sensations are present to be felt right now as you focus attention on the right hand. And focusing the attention now into the area of the wrist of the right arm, and the lower arm of the right arm, the inside and outside of the forearm, the inside and outside of the area of the wrist. Just noticing again whatever sensations are present in the wrist and the forearm of the right arm. And including in this focus of attention the area of the elbow of the right arm, the inside of the elbow, the outside of the right elbow. And including in the focus of attention the upper arm of the right arm, the area of the biceps, the front of the upper arm, the back of the upper arm. And again, just noticing whatever sensations are present in the upper area of the right arm. And expanding now this focus of attention to include in the focus of attention the entirety of both arms. Bringing attention to the fingers and hands of both arms, the wrists and forearms, the elbows and upper arms. And focusing the attention now on the experience of the sensations in both arms. Just allowing whatever sensations are present to be felt, or noticing that there's no particular feeling at all in the experience of both arms, but allowing that experience to be however it is right now. And if you care to, allowing the arms to feel a little softer, to feel a bit more relaxed or a bit heavier as they rest in contact with whatever you're lying on, and just noticing the consequences of having softened the arms. And letting go now of focusing the attention in the area of the arms and focusing the attention into the area of the shoulders and the neck. The shoulders are often an area that accumulate tension throughout the day, so perhaps noticing if there's any kind of tightness in the area of the shoulders, and just allowing that to be however it is. Focusing the attention into the area of the neck, the back of the neck, the area of the throat, and focusing the attention now into the area of the jaw. This is also an area that can accumulate a sense of tightness and tension. So just noticing whatever sensations are present in the area of the jaw. And if you care to, allowing the jaw to just relax a bit, maybe allowing the mouth to just open a bit as the jaw softens and relaxes, and just noticing what that feels like. And focusing the attention on the area of the lips, and the mouth, perhaps including in the focus of attention the area of the teeth and the tongue. Just noticing again whatever sensations are present or whatever this experience is. In this moment, and including in the focus of attention the area of the cheeks of the face, the area of the nose and the nostrils, perhaps even noticing the sensation of the breath flowing in and out of the nostrils, or no particular sensation at all. And including in this focus of attention the area of the face around the eyes, the eyebrows, the area of the temples, the sides of the face. Focusing the attention into the area of the forehead, recognizing that the area of the face is also a place that can accumulate tightness and tension. Just noticing again whether there's any kind of tightness or any other sensations in the area of the eyes and the forehead and the temples. And if you care to, just allowing that part of the face to just feel a bit softer, feel a bit more relaxed, and just notice what that feels like in this moment. Continuing to include in the focus of attention the area of the scalp, the top of the head, the sides of the head, the area around the ears, the area of the scalp on the back of the head, perhaps noticing the sense of pressure or heaviness or contact with whatever you happen to be lying on. And including now, if you care to, in your focus of awareness, this focus of attention, the whole body. Bringing into this focus of attention the body in its entirety. Just noticing what the experience is now of the body lying here in stillness, relaxation. Just allowing this experience to be however it is right in this moment. Perhaps taking a moment to congratulate yourself for having taken this time for your own self-care. And when you're ready, in your own time and in your own way, perhaps beginning to gently move the toes and the fingers, bringing some movement back to the toes and the fingers. Gently moving the feet, the ankles, the hands and the wrists, bringing some gentle movement back to the feet and the hands. Perhaps allowing the legs to begin to move, the arms to move as we return movement to the body. And when you're ready in your own way, perhaps rolling onto one side or the other, and then just gently pushing yourself back up to a seated position. Taking your own time to do this in your own way. And when you've returned to a seated position, as best as possible, bringing the same quality of attention and awareness into the rest of your day.